Hi, I'm Marina Fogle.
And I'm Dr. Chiara Hunt.
We're the founders of the Bump Class and the authors of the Bump Class, an expert guide to pregnancy. We talk to women about birth and labour every day, and we're going to talk a little bit about when to know when to go into hospital. This is a really hot topic in our classes and something people are really keen to know about. So in early labour, in the latent stage, we know that the best place for pregnant women is usually at home, and we do encourage women to stay at home for as long as they can. That said, there will be a time where you will want to go to hospital if that's where you're planning on delivering your baby. So how do you know when that time is?
As a general rule, the contractions will become more regular, and once you're getting regular contractions every 3 minutes or so, or they say as a rough guide 3 contractions in 10 minutes, then you should start thinking about going to hospital then.
There's a lot of information about timing contractions, and the important thing to remember when you're timing contractions is to time them from the start of one contraction to the start of the next contraction. Luckily now, for the 21st century pregnant woman, there are a range of apps that will do this for you and accurately time your contractions.
Yeah. So what about your waters breaking? Do you have to go to hospital if your waters break? The answer is no, you don't have to go in straight away, but you do have to tell the hospital that your waters have broken, and they'll ask you a few questions about that. And we talk a lot about waters breaking in the book and what to look out for. Your waters can break any time from before your first contraction has started to literally just before your baby's born. So your waters breaking don't really tell you anything about how far along into labour you are.
That said, it's a great sign that labour is progressing nicely, so definitely worth letting the hospital know, and they might or might not invite you to come in. The other thing that's really important to keep an eye on in the latent stage of labour are movements. It is absolutely not true that you will not feel your baby's movements in labour. You will feel your baby's movements, and it's important that you monitor your baby's movements. And if you notice a change or a reduction in the movements, or the movements not happening at all, it's really important that you go into hospital immediately and get checked out.
And another reason you'd want to go immediately to hospital is if there is any bleeding at all during the labour.
It's quite common for there to be a little bit of streaky bleeding in what's called the show, which we describe in the book. But fresh blood is not normal in labour and definitely something you need to be seen for immediately.
Yeah.
The crucial thing in this latent stage of labour is that while you may be at home, you're not alone, and you should be in touch with your labour ward and speak to them as much as you want. The other reason to go into hospital is even if you aren't getting any of these signs, but you just want to go in to be checked out, they're very much there to support you in the labour ward. So if you just want to go in at any time, do go in and be reassured.
Quite a good tip is, if you can, try and speak to the same midwife, either on the birth centre or on the labour ward that you're delivering, because then that midwife will have an idea of how things are progressing and how you are now compared to how you were when you called last time.
And keep an open mind. A lot of first-time women will go into hospital thinking they're in established labour, but they're not, and they'll be encouraged to go home. And don't regard this as a failure. It's really normal, and the majority of first-time mothers will be seen before they are in active labour and encouraged to go home again.
Just remain positive.
Positive, and don't forget your notes. Really important to bring your notes with you when you go to hospital. There's lots more information in our book, so do have a good read of that.